Are you ready to pass your stroke nurse exam on your very first try? These practice questions include full explanations to help you build confidence and move towards certification more easily. If you enjoy this course, please subscribe and check the description below to get access to the full course. Also, leave your suggestions in the comments. Your feedback helps improve future lessons. Disclaimer: we are not affiliated with any official stroke certification board, and these are not leaked exam questions. This course is designed to closely follow the official exam curriculum and focus on the concepts most important for success. In Section 1, we begin with brain anatomy and stroke types, understanding how blood reaches the brain through the carotid arteries and vertebral arteries. You will learn the difference between ischemic stroke, caused by blocked blood flow, and hemorrhagic stroke, caused by bleeding in the brain, and why rapid identification is critical. You will also review key stroke assessment concepts, including CT scans, the NIHSS scale, blood pressure monitoring, blood sugar checks, and recognizing symptoms such as weakness, aphasia, and neglect. Remember, the left side of the brain controls the right side of the body, and the right side controls the left. Always assess swallowing before food or drinks, because aspiration is a serious risk after stroke. Read each question carefully, take your time, and let's begin practicing. 1. What is the very first test we do for a suspected stroke patient? We must do a CT scan of the head without using any contrast dye. This quick scan helps us see if there is any bleeding in the brain. 2. Why do we always check blood sugar when a stroke is suspected in triage? Low blood sugar can cause symptoms that look exactly like a real stroke. Fixing the sugar level might make all the scary stroke symptoms go away completely. 3. Which scale do we use to measure how severe a stroke really is? We use the National Institutes of Health Stroke Scale to check the patient. This scale gives us a number to see if the patient is improving later. 4. What happens if a patient gets a clot in their middle cerebral artery? They will usually have weakness in their face and arm on one side. The middle artery feeds the parts of the brain that control the face and arms. 5. How fast should the doctor read the head CT scan after the patient arrives? The doctor needs to read the brain scan within 45 minutes of arrival. Acting fast saves brain tissue, so we keep strict time limits for our tests. 6. What is the main cause of an ischemic stroke in most of our patients? A blood clot blocks a blood vessel and stops oxygen from reaching the brain. Without oxygen, the brain cells begin to die very fast in that specific area. 7. Which stroke type happens when a weak blood vessel bursts open in the brain? This condition is called a hemorrhagic stroke, and it causes bleeding inside the head. We cannot give blood thinners for this type, because it will cause more bleeding. 8. What does it mean if a stroke patient has a problem called expressive aphasia? The patient knows what they want to say, but they cannot form the words. This usually happens when the left side of the human brain gets badly damaged. 9. Why must you check the patient's swallowing before giving him any pills or water? Stroke patients often lose muscle control, which makes them choke on food or drinks. If food goes into the lungs, it will cause a very bad lung infection. 10. What blood pressure medicine do we often use first for a bleeding brain stroke? We often use a medicine called labetalol to bring the blood pressure down safely. Lowering the pressure helps stop the broken blood vessel from bleeding more inside. 11. How do we quickly check for facial droop when assessing a new stroke patient? You should ask the patient to smile big and show you all their teeth. If one side of the face does not move, it is a danger sign. 12. What happens to a patient who experiences a stroke in the brain stem area? They can have breathing problems and weakness on both sides of their whole body. The brain stem controls basic life functions, so this type of stroke is deadly. 13. Why is it important to know exactly when the stroke symptoms first started showing? We only have a short time window to give special clot-busting stroke medicines. If we give the medicine too late, it can cause bleeding in the brain. 14. What is a transient ischemic attack, and why is it a big warning sign? It is a mini-stroke where symptoms go away completely in a short time. It warns us that a very big stroke might happen in the near future. 15. How often should we check the patient's nerve signs after giving clot-busting drugs? You must check them every 15 minutes for the first 2 hours of treatment. This helps us catch any sudden bleeding in the brain as early as possible. 16. What is the most common heart rhythm problem that causes an ischemic brain stroke? Atrial fibrillation is a bad heart rhythm that throws blood clots to the brain. The heart beats irregularly, and the blood pools inside until a clot is formed. 17. Why do we keep the stroke patient's body temperature normal, instead of too hot? A high fever makes the brain need more oxygen, which damages the cells faster. We use cooling blankets and medicine to keep the patient safe from heat damage. 18. What side of the body gets weak if the right brain has a stroke? The left side of the patient's body will become weak or paralyzed right away. The nerves cross over in the neck, so each side controls the opposite half. 19. What should you do if the stroke patient starts ignoring their left arm completely? You must remind them to look at their left side, to keep them safe. This problem is called neglect, and we must teach the patient to pay attention. Welcome back to Section 2 of our Stroke Nurse Certification Practice course. In this section, we focus on early patient care and medication management, because fast and safe action can protect brain function and improve outcomes. One of the most important treatments is alteplase, also called TPA, a clot-busting medicine used for eligible stroke patients. Nurses must calculate the exact dose based on patient weight, give 10% as an initial push, then continue the remaining dose slowly over 1 hour, while closely monitoring blood pressure and watching for warning signs of complications. Before giving TPA, nurses must confirm there is no bleeding in the brain and keep blood pressure under control to reduce bleeding risk. After treatment, patients still require close observation, and invasive procedures should be avoided for about 20 hours when possible. Some patients may receive mechanical thrombectomy, where doctors remove the clot through a blood vessel, and nurses must monitor circulation, leg condition, and signs of bleeding afterward. Early feeding support, safe swallowing practices, and careful positioning also play an important role in recovery. Preventing complications is just as important as treating the stroke itself. Nurses help reduce the risk of leg blood clots with compression methods, safe movement, and medications when approved. Frequent repositioning also protects skin health and comfort. Learn these steps carefully, because they can make a real difference in patient outcomes. Subscribe to the channel, and get the full course through the link in the description below. Now, Let's continue with the next set of practice questions and keep building your stroke nursing knowledge. 20. What is the maximum time window to give intravenous alteplase to a patient? We usually give it within 4.5 hours of symptom start. If we wait too long to give it, the risk of brain bleeding becomes much higher. 21. What must the blood pressure be before we start giving the alteplase medicine? The blood pressure must be lower than 185/110. High pressure inside the blood vessels will make the medicine cause dangerous bleeding in the brain. 22. How often do we check blood pressure during the 1-hour alteplase drip? We must check the patient's blood pressure every 15 minutes during the drip. This helps us catch sudden high pressure, which can cause bleeding in the soft brain tissue. 23. What should you do immediately if the patient gets a severe sudden headache? You must stop the alteplase drip fast and call the doctor right away. A bad headache often means the patient is bleeding inside their brain from the strong medicine. 24. Why do we avoid putting tubes in the patient after giving clot busters? We wait 24 hours to stop the patient from bleeding too much. Poking the skin with needles or tubes will cause severe bleeding that is hard to stop. 25. What is the very first medicine we give for a suspected ischemic stroke? The doctor usually orders a regular aspirin to thin the patient's blood safely. Aspirin helps stop new clots from forming, and it protects the brain from more sudden damage. 26. What happens during a mechanical thrombectomy procedure for a bad stroke patient? A doctor uses a special long wire to pull the clot out physically. This works very well for big clots that normal medicines cannot break down in the brain. 27. After a leg artery procedure, how should the patient lie in their bed? The patient must lie perfectly flat and keep their leg completely straight down. Bending the leg can make the artery open up and cause a lot of internal bleeding. 28. How do we check for good blood flow in the patient's punctured leg? We feel the pulses in their foot and check the skin color often. A cold foot with no pulse means the main leg artery is blocked and needs help. 29. Why do we use special tight socks on a stroke patient in bed? The tight socks squeeze the patient's legs to stop blood clots from forming. When patients do not walk, their blood slows down and forms dangerous clots in their legs. 30. What is a big risk for a stroke patient when they eat food? They have a high risk of choking because their throat muscles are weak. Food or water can slip into their lungs, which causes a very bad infection called pneumonia. 31. How should you place the patient in bed before you feed them food? You must sit the patient up high at a 90-degree straight angle. Sitting up straight helps the food go down the stomach tube instead of the human lungs. 32. What should you do if the stroke patient starts coughing while drinking water? You must stop giving them water and tell the speech doctor right away. Coughing means the water is going into the lungs, so they need a safe swallowing test. 33. Why do we test the patient's vision during the daily stroke nurse check? Stroke patients often lose half of their vision in both of their eyes. If they cannot see food on their plate, they might not eat enough to heal properly. 34. How do we communicate with a stroke patient who has bad expressive aphasia? We use simple picture boards and ask questions with a yes or no. Picture boards help the patient share their needs without getting too frustrated with their broken words. 35. What is the best way to help a patient who has left neglect? You should stand on their left side to force them to look over. Teaching them to turn their head helps them notice the left side of the whole world. 36. Why do we move the patient in their bed every single 2 hours? We move them to protect their skin from getting very bad bed sores. Lying in one spot cuts off blood flow, which makes the human skin break down fast. 37. What should we do if the patient's blood sugar is very high suddenly? We must give them insulin medicine to bring the blood sugar down safely. High sugar makes the brain damage worse, so we keep the sugar levels normal during care. 38. What is the most important teaching before the stroke patient goes back home? We must teach them and their family the warning signs of a stroke. Knowing the warning signs helps them call for help fast if a new stroke happens again. Welcome back to Section 3 of our Stroke Nurse Practice course. In this section, we focus on helping patients prevent another stroke and stay healthy after leaving the hospital. Nurses play an important role in education and recovery by teaching patients to manage blood pressure, control cholesterol, monitor blood sugar, and recognize warning signs early. Patients with conditions like atrial fibrillation may also need blood thinners, and families should understand how these treatments reduce future stroke risk. Recovery is not only physical, it is emotional too. Some patients experience depression after stroke, while others develop muscle stiffness or difficulty swallowing. Nurses should encourage stretching, physical therapy, safe eating habits, and emotional screening before discharge. Patients and families should also learn fall prevention at home, including removing hazards and supporting safe movement during daily activities. Lifestyle changes make a huge difference in long-term recovery. Quitting smoking, following healthy eating habits, taking medicines correctly, and attending follow-up care can lower future stroke risk and improve quality of life. Now get ready for the next practice questions. Take your time, think carefully, and keep building your confidence for exam success. If this course is helping you, subscribe to the channel and get the full course from the link in the description below. 39. What daily pill do most stroke patients take to prevent another ischemic stroke? They usually take a baby aspirin daily to keep their blood from clotting. Aspirin stops the blood cells from sticking together, which prevents new blockages in the brain pipes completely. 40. Why does the doctor order a statin pill for a recovering stroke patient? Statins lower the bad cholesterol in the blood to keep the arteries clean. Lowering cholesterol stops fat from building up, which reduces the chance of another blocked brain blood vessel. 41. What is a safe home blood pressure goal for a typical stroke survivor? We usually want their home blood pressure to be less than 140. Keeping the blood pressure normal and stable helps protect the weak blood vessels inside the human brain. 42. What kind of strong medicine do we give for a patient with atrial fibrillation? We give them a strong anticoagulant pill to thin their blood out safely. This strong medicine stops big clots from forming inside the shaking heart, keeping the brain very safe. 43. What common mental health problem do we see in patients recovering from strokes? Many stroke survivors suffer from severe depression because their brain is healing slowly. The brain damage and loss of normal life can make the patient feel very sad and hopeless. 44. What do we call the tight and painful muscles after a stroke happens? This painful muscle tightness is called spasticity, and it makes moving very hard. The damaged brain sends the wrong signals, causing the arm or leg muscles to stay tightly flexed. 45. What special injection can the doctor give to help relax very tight muscles? The doctor can give Botox injections directly into the tight and painful muscles. Botox blocks the bad nerve signals temporarily, which allows the tight muscle to relax and stretch out. 46. What is the best way to prevent dangerous falls in the patient's bathroom? You must tell the family to install strong grab bars near the home toilet. Grab bars give the weak patient something strong to hold onto, which stops them from falling down. 47. Why is quitting smoking so incredibly important for every single stroke survivor? Smoking makes the blood very sticky, and it ruins the healthy blood vessels. If the patient stops smoking cigarettes quickly, their risk of another stroke drops by a huge amount. 48. What nighttime breathing problem increases the risk of having a second bad stroke? Obstructive sleep apnea is a big danger because the patient stops breathing asleep. Stopping breathing drops the oxygen in the blood, which puts a lot of stress on the brain. 49. What machine do we use at night to treat a patient's sleep apnea? We use a CPAP machine to push fresh air into the patient's lungs. The air pressure keeps the breathing tubes open wide, so the brain gets enough oxygen all night. 50. What type of healthy daily diet is best for preventing another brain stroke? The Mediterranean diet is highly recommended because it uses healthy fats and vegetables. Eating fresh fish and healthy olive oil keeps the blood vessels clean and protects the human heart. 51. How much exercise should a stroke survivor try to get every single week? They should aim for 150 minutes of moderate weekly exercise. Regular walking keeps the heart muscle strong and helps lower the patient's blood pressure naturally and safely. 52. What is the long-term blood sugar test we check for diabetic patients? We check the hemoglobin A1C blood test to see their average sugar levels. Keeping this number below 7% protects the tiny blood vessels in the brain from sugar damage. 53. How should you place objects for a patient who has bad left neglect? You should place important items on their right side so they easily see them. Until their brain learns to look left again, we must keep their food and phone easily visible. 54. What surgery cleans out the fatty blockages from the big neck blood vessels? The surgery is called a carotid endarterectomy, and it removes the bad plaque. Cleaning out the neck artery allows fresh blood to flow up to the brain without any blockages. 55. What brain problem can happen months later because of an old stroke scar? The patient might start having dangerous seizures because the brain scar causes electrical sparks. If a seizure happens at home, they will need special daily pills to calm their brain waves. 56. Which special hospital therapist helps the patient learn how to speak clearly again? The speech and language therapist works hard to fix the patient's talking problems. They use special mouth exercises and word games to train the brain to find the right words. 57. What is a huge risk for the family members taking care of patients? Caregiver burnout is a big problem because taking care of someone is physically exhausting. We must offer the family support groups so they can take a break and protect their health. Please remember to check the video description box below to get the full course. Welcome back to Section 4 of our Stroke Nurse Certification Practice course. In this section, we focus on brain bleeding and serious complications after stroke. One major danger is increased intracranial pressure, where swelling inside the brain builds pressure against the skull. Watch for warning signs like extreme sleepiness, reduced responsiveness, and sudden vomiting. Keep the head of the bed raised to 30 degrees, maintain a straight neck position, and follow treatment orders carefully, because reducing pressure quickly can protect brain tissue and improve outcomes. Another critical emergency is subarachnoid hemorrhage, which happens when an aneurysm bursts and causes bleeding around the brain. Patients often describe it as the worst headache of their life, and may also develop neck stiffness and sensitivity to light. Treatment may involve surgical clipping or coiling to stop the bleeding. After treatment, monitor closely for vasospasm, where blood vessels tighten and reduce blood flow, creating risk for another stroke. Medicines like nimodipine are commonly used to help prevent this complication. Seizures can also happen after severe strokes because damaged brain tissue disrupts normal electrical activity. If a seizure occurs, protect the patient from injury, never place anything in their mouth, and position them safely to support breathing. Frequent neurological checks help detect changes early and allow faster intervention. You are building practical knowledge that helps improve patient care and outcomes. Subscribe to the channel and get the full course through the link in the description below. Now, let's continue with question 58. 58. What is the very first sign that a stroke patient has brain swelling? The patient will become very sleepy, and they will be hard to wake up. Changes in how awake they are is the earliest sign of brain pressure going up. 59. How many degrees should you raise the bed for a patient with brain swelling? You must raise the head of the bed to exactly 30 degrees straight up. 30 degrees is the perfect angle to help extra fluid drain from the human brain. 60. Why do we keep the patient's neck perfectly straight when they have brain pressure? A bent neck blocks the big neck veins, which traps fluid inside the head. Keeping the neck straight allows blood to flow out safely, which lowers brain pressure quickly. 61. What strong salty medicine do we give to shrink a very swollen human brain? We often give hypertonic saline through an IV to pull water out of the brain. The strong salt acts like a sponge, pulling bad swelling fluid away from the cells. 62. What is a subarachnoid hemorrhage, and why is it a medical emergency? It is bleeding over the brain surface, usually from a popped weak blood vessel. This type of bleeding spreads very fast, and it can kill the patient very quickly. 63. What symptom do patients always complain about when a brain aneurysm bursts open? They will scream that they have the worst headache of their entire human life. The sudden blast of high-pressure blood causes extreme pain inside the patient's head instantly. 64. Why does a patient with brain bleeding hate looking at bright hospital lights? The loose blood irritates their brain coverings, making their eyes very sensitive to bright light. We call this problem photophobia, and keeping the room dark helps them feel much better. 65. What pill do we give every 4 hours to stop brain vessels from squeezing? We give a pill called nimodipine to stop the dangerous vasospasm squeezing completely. Nimodipine relaxes the smooth muscles in the brain pipes, keeping them open for fresh blood. 66. How does the surgeon fix a bleeding aneurysm using a small metal device? The surgeon places a tiny metal clip right across the neck of the bleeding bubble. The tight metal clip stops blood from entering the bubble, so it cannot burst again. 67. What is the biggest risk for the patient a few days after a brain bleed? The brain vessels might spasm and squeeze shut, causing a brand new ischemic stroke. Vasospasm usually happens 3 to 10 days after the first bleed, requiring very close watching. 68. How do we test for vasospasm without cutting the patient's head open? We use a special ultrasound machine on their head to check the blood flow speed. A transcranial Doppler ultrasound is a safe test to see if the pipes are squeezing. 69. What must you do if a stroke patient starts having a full body seizure? You must turn them on their side quickly and protect their head from hitting things. Keeping them safe is the top priority, so they do not get more brain damage. 70. Why is it very dangerous to put a spoon in a seizing patient's mouth? The patient will bite down extremely hard, and they will break all their teeth completely. Broken teeth can fall into their throat, causing them to choke and stop breathing fast. 71. What daily medicine do we give to stop seizures from happening again at home? We usually give a pill called levetiracetam to calm down the electrical brain sparks. This medicine stops the damaged brain scar from starting a new violent seizure event suddenly. 72. Why do we keep the room very quiet for a patient with a brain bleed? Loud noises and stress can raise their blood pressure, causing the brain to bleed more. A dark and quiet room helps keep their heart rate low, protecting the weak blood vessels. 73. What is hydrocephalus, and why does it happen after a brain stroke? It is a build-up of natural brain water, because the bleeding blocks the normal drains. Extra water makes the brain swell up, and the doctor must put in a drain tube. 74. What kind of tube does the surgeon use to drain extra water from the brain? They place an external ventricular drain to pull the bad fluid out of the head. This plastic tube goes straight into the brain fluid and connects to a small bag. 75. Why do we check the patient's pupils with a light during our nerve checks? If one pupil gets very big and stays big, it means the brain is swelling. High brain pressure crushes the eye nerve, stopping the pupil from shrinking in the light. 76. What happens if the brain pressure gets so high that the brain gets pushed down? This is called brain herniation, and it will kill the patient in a few short minutes. The brain stem gets crushed at the bottom, which stops the heart and breathing instantly. Welcome back to Section 5 of our Stroke Nurse Certification Practice course. In this section, we will focus on testing and discovering the real cause of a stroke. Finding the exact reason behind a sudden stroke is very important, because understanding the cause helps reduce the risk of another stroke in the future. Doctors often begin by checking the heart using an echocardiogram, a sound-based test that can detect hidden blood clots. If clearer images are needed, they may perform a transesophageal echocardiogram, which uses a small tube through the throat to view the back of the heart more closely. Heart rhythm and blood flow testing are also essential parts of stroke evaluation. A Holter monitor records the heart's activity for several days and helps detect atrial fibrillation, an abnormal rhythm linked to stroke risk. Doctors may also perform a carotid ultrasound to examine blood flow in the neck arteries and look for dangerous blockages. MRI scans provide highly detailed images of the brain and can reveal small strokes that may not appear on a CT scan, but all metal objects must be removed before entering the MRI area. Blood testing also plays an important role in stroke care. Doctors check cholesterol levels with a lipid panel, measure long-term blood sugar using hemoglobin A1C, and review clotting values such as PT and INR, especially for patients using blood thinners. A complete blood count can also identify infections that may worsen stroke symptoms. Now, get ready for the fifth set of practice questions, and continue building your confidence for exam day. Please subscribe for more helpful exam preparation content, and remember to check the video description below to get access to the full complete course. 77. What test uses sound waves to check the valves of the human heart? We use a standard echocardiogram to look at the heart valves and muscles. This test helps us find bad blood clots that might travel to the brain. 78. Why do we put a tube down the throat for a T-heart test? The throat tube gets closer to the heart, taking much better and clearer pictures. It helps the doctor see hidden blood clots in the back of the heart. 79. What does a portable Holter monitor do for a new stroke survivor patient? It records the heartbeat for a few days to find dangerous shaking heart rhythms. Finding atrial fibrillation is very good, because we can give blood thinners to help. 80. How does a carotid ultrasound help us find the cause of a stroke? It uses sound waves to see bad fat, blocking the big neck blood vessels. If the neck pipes are very blocked, the brain will not get enough blood. 81. What must you remove from a patient before they get a brain MRI scan? You must remove all metal jewelry and devices, because the MRI is a magnet. The strong magnet will pull metal objects hard, causing very bad injuries to people. 82. Why is an MRI scan much better than a regular head CT scan test? An MRI shows very tiny areas of brain damage that a CT scan misses. We use the MRI to see the exact size of the early stroke damage. 83. What blood test shows us the patient's average blood sugar over 3 whole months? The hemoglobin A1C test shows the average sugar for the past 90 days exactly. High average blood sugar damages the blood vessels, leading to a much higher stroke risk. 84. Which blood test checks the bad fat levels floating inside the patient's blood system? The lipid panel checks the bad cholesterol levels floating around in the human blood. High cholesterol leaves bad fat in the pipes, which blocks blood flow completely soon. 85. What does the PT and INR blood test tell us about the patient's health? These tests measure exactly how fast the blood forms a solid clot to stop bleeding. We use these test numbers to adjust the dose of strong blood thinner pills. 86. Why do we check a complete blood count for every single new stroke patient? It checks the white blood cell count to see if the patient has an infection. A bad infection can make a stroke much worse, so we must treat it fast. 87. What does a high platelet count mean for a person having a brain stroke? A high platelet count means the blood is sticky and clots way too easily. Sticky blood cells gather together in the pipes, blocking the oxygen to the brain. 88. What is an MRA scan, and why do doctors use it for stroke patients? An MRA uses magnets to look at the blood vessels inside the human brain. It helps the doctors find very weak blood vessels that might burst and bleed. 89. Why do we test the patient's urine after they have a bad brain stroke? We check for a bad bladder infection because it can make the patient very confused. Confusion from a bladder infection looks like a stroke, so we must give antibiotics. 90. What is a cerebral angiogram, and how does it help a stroke doctor out? The doctor puts dye in the blood vessels and takes special clear X-ray pictures. This test shows exactly where the blood pipe is blocked or broken open completely. 91. What should a nurse check after the doctor finishes a cerebral angiogram leg procedure? You must check the patient's leg pulses and look for bad bleeding at the site. The doctor pokes a big leg artery, so we must prevent any dangerous internal bleeding. 92. How does a bubble study test work during a normal human heart echocardiogram exam? The nurse pushes salty water with tiny bubbles straight into the patient's arm vein. The doctor watches the tiny bubbles travel to see if the heart has a hole. 93. Why is a hole in the heart a very big danger for a stroke? A hole lets a bad blood clot skip the lungs and travel to the brain. The doctor can fix this small heart hole using a special wire surgery procedure safely. 94. What does the doctor look for on a 12-lead electrocardiogram or ECG test? The doctor looks for any signs of a heart attack or dangerous shaking heart rhythms. A bad heart problem is often the main reason why the brain stroke happened first. 95. Why do we keep the patient on a heart monitor for their whole hospital stay? The monitor alarms us immediately if the patient's heart stops beating or shakes too much. Watching the heart closely prevents sudden death and helps us give fast emergency medicine safely. Welcome back to Section 6 of our Stroke Nurse Certification Practice course. In this section, we focus on rehabilitation and helping patients regain independence after a stroke. Recovery takes time, patience, and consistent nursing care. Physical therapy helps patients walk safely and improve movement, while occupational therapy supports daily tasks like dressing and eating. Always assist patients from their weak side, use mobility aids correctly, and protect their skin by repositioning every 2 hours to prevent pressure injuries. Stroke recovery also includes bladder and bowel training, because many patients experience loss of control after the event. Encourage regular toilet schedules, healthy hydration, and fiber-rich meals to support normal function and comfort. Watch closely for complications caused by immobility, including deep vein thrombosis, leg swelling, or signs of a pulmonary embolism. Encourage ankle exercises, Monitor daily weight changes, and avoid pulling on a weak arm to prevent painful shoulder subluxation during movement. Family education is equally important, because recovery continues long after leaving the hospital. Teach caregivers safe transfers, proper use of lifting equipment, and how to create a safer home environment by reducing fall hazards. Recovery may be challenging, but each small improvement matters. Take your time with the upcoming practice questions, and continue building your confidence for exam success. Also, please subscribe, and check the video description below to get access to the full complete course. 96. What side of the patient should you stand on when you help them walk? You must always stand on their weak side to catch them if they fall down. The weak side gives out easily, so your body blocks them from hitting the floor. 97. What tool helps a nurse lift a weak patient without hurting their own back? We use a special gait belt around their waist to lift them up very safely. The belt gives you a strong handle to pull their body weight up with ease. 98. Why do we put soft pillows under the stroke patient's heels in the hospital bed? Pillows keep the heavy heel bones off the bed, stopping bad skin sores from forming. The heel has very little fat, so the skin breaks down fast under constant pressure. 99. What does an occupational therapist teach a patient after they have a bad stroke? They teach the patient how to dress themselves and eat food using special heavy spoons. This therapy focuses on small hand movements, helping the patient regain their personal daily independence. 100. Why do we avoid using a plastic catheter tube for a patient's bladder problems? A plastic tube allows bacteria to enter the bladder, causing a very dangerous urine infection. We prefer taking the patient to the toilet often to retrain their bladder muscles naturally. 101. How often should we take the patient to the bathroom for good bladder training? You should take them every 2 hours to help them pee before they lose control. A strict toilet schedule trains the brain to hold the urine longer over a few weeks. 102. What happens to the paralyzed shoulder joint when gravity pulls the heavy arm down? The heavy arm pulls the bone out of the socket, causing a painful shoulder subluxation. The weak muscles cannot hold the joint together, so it drops down and causes pain. 103. Why must you never pull a stroke patient by their paralyzed and weak arm? Pulling the weak arm will tear the soft muscles and completely dislocate their shoulder joint. Always use their strong body trunk or a lifting belt to move them up safely. 104. What do we use to support a paralyzed arm when the patient walks around? We use a soft arm sling to hold the heavy arm close to their chest. The sling takes the weight off the weak shoulder joint, preventing any further painful stretching. 105. How does adding healthy fiber to the patient's diet help their stroke recovery process? Fiber prevents very hard bowel movements, keeping the patient from pushing too hard on the toilet. Pushing hard on the toilet raises brain pressure, which is very dangerous for stroke patients. 106. Why do stroke patients often get very bad constipation while resting in the hospital? They do not walk around much, and their pain medicines slow down their human bowels. Moving the body helps the bowels move food, so lying in bed causes severe constipation. 107. What should the family do to the home floors before the patient comes back? The family must remove all loose rugs and keep the walking paths very clear always. Small rugs cause the weak patient to trip, which leads to bad falls and broken bones. 108. How should we talk to a patient who has trouble understanding our spoken words? You must use very short sentences and give them plenty of time to answer you. A damaged brain processes words very slowly, so speaking fast will just confuse them more. 109. What side of the shirt should the patient put on first, when getting dressed? They should always put their weak arm into the shirt sleeve, before their strong arm. Dressing the weak arm first is much easier, because the strong arm can do the pulling. 110. Why is good mouth care so important for a patient with a feeding tube? A dirty mouth grows bad bacteria, which can slide down into the patient's soft lungs. Cleaning the teeth and tongue daily prevents deadly lung infections like pneumonia from starting. 111. What kind of thick liquid is safest for a patient with a swallowing